Yes, like we say some few minutes ago, say we go meet for another corner. Yes, now the corner be this. Now the health matter segment. Now we dey where we dey talk about health. Well, now sef feel free to call in and ask anything as is dey concerned with health. For we health experts, Doctor wey sabi, I dey talk about no other person but Dr. Bat. Everything as far as health dey concerned. Now we go dey talk about. Good morning once again, sir.
Good morning, Chief.
How the patient?
We thank God.
Drippy they go.
We thank
Injection they go.
Thank you, sir.
Tablet they go.
Yes, sir.
Thank you very much.
Doctor, good morning.
Hey, Carol.
How you doing,
You're
sir?
looking sweet.
Thank you.
With a lovely hairdo or hairstyle.
That they call it Alsakis.
Eh?
Alsakis.
No, this is unique.
It's Alsakis.
Okay.
Thank you, sir.
Yeah.
Thank
Good morning, viewers at home and around the world. We treated malaria a couple of weeks back, but today we are going to look at something that usually we talk about in Nigeria as common as we do when it comes to malaria. Talking about no other disease than typhoid fever, also known as enteric fever. Sometimes the way we describe it, you would think that a set of twins. Usually patients walk into the hospital and they're asking doctor, I want to do typhoid and malaria, or treat me for typhoid and malaria. So it would be nice having talked about malaria a couple of weeks back so that we can actually look at typhoid today and see, are there differences between these two disease entities or not? Okay, so I will introduce the topic. We're going to do the outline as follows. We're going to look at introduction, etiology, that is causes, epidemiology, pathogenesis, clinical features, as well as treatment and conclusion. What is typhoid fever, or enteric fever if you like? Typhoid fever, also known as enteric fever, is an infectious disease of public health concern. An infectious disease that originates from the gastrointestinal tract with subsequent systemic involvement, often overdiagnosed and sometimes misdiagnosed with far-reaching implications. What causes typhoid fever? It's caused by a bacterium known as Salmonella typhi. Different from salmonellosis. Typhoid fever, the major bacteria that causes typhoid fever is called Salmonella typhi. There are other associated bacteria that equally causes infection with typhoid fever that are referred to as paratyphi, A, B, and C. Okay, but the one that is of major importance is Salmonella typhi, which we'll be discussing in full today. It is a gram-negative bacilli, if you like, usually found in water, food, and milk. It's a motile organism. It moves, has a covering referred to as capsule, has flagella, as well as somatic antigen. Humans are the only carriers of typhoid. It has a worldwide distribution, but it doesn't affect all areas of the world to the same magnitude. It's not as common as malaria, or sometimes we make it look. For instance, industrialized nations of the world have the lowest prevalence when it comes to typhoid fever. Okay? But we have the highest incidence in some parts of Southeast Asia, Central America, moderate incidence in some parts of Africa, as well as other regions of the world. It causes about 200,000 deaths in a year. WHO puts the figure to about between 128 to about 160,000 deaths annually. Now, if you look at when we discussed about malaria, you can see that that cannot be compared in terms of the number of deaths that this can cause in a period of 1 year. It's usually a disease that has so much to do with poor hygiene, poor sanitation, overcrowding. Okay, we're going to see more as we move on. What are the clinical features of this disease? How does it present? It presents in a number of ways. Sometimes it may show no symptom, in which case it could be asymptomatic. As a matter of fact, there are some people who are referred to as carriers. They harbor this organism within their system, within their gut. They don't have the disease, but they have the capacity to pass it out in their feces and sometimes urine. And when this feces contaminates food sources or food materials, other people can actually pick it up. So one of the major routes of infection is what we refer to as fecal-oral route or fecal-oral transmission route. Okay. What that means is when you have fecal matter, that's feces, contaminating food materials like water and some other things, and then if an individual who does not have it ends up picking this up, it can easily develop the disease. So some people are carriers. Okay. They have the organism within their system. They don't have the disease at that moment, but they have the capacity to pass it across to others. Okay, so that's why it's advisable that anytime we make use of the toilet, we need to wash our hands properly. In situations where we may not be able to wash our hands, because these are diseases that we said that can be found in feces and sometimes in the urine. You can agree with me that it's not all the times that we urinate when we are outside our normal environment that we're able to see water to wash our hands. In situations like that, when you can't get water to wash your hand, you can actually use sanitizers, alcohol, sanitizer that contains alcohol. You can use it to disinfect your hands. Because if you don't do, you may be pumping hands with your next friend the next minute who may not even know. And before you know it, someone gives you something that you can easily peel. And then, of course,
you take it in.
Without knowing, you're contaminating what you're eating.
But doctor, how is it possible to be a carrier and it will not manifest?
Yes, it's possible because we have seen that it has been documented and we have seen that plenty of times. It's not only in typhoid, a number of disease conditions, some people will have it, but they may not come down the disease. It may have to do with the person's immune system and some other factors. Okay? Now, going back to the epidemiology, we said that typhoid fever is rare in some industrialized nations of the world, ostensibly as a result of their ability to tidy up their sewage system, okay, as well as sewage treatment plants or systems, okay, which we don't often have in developing countries of the world. We have said that it is found worldwide. It's rare in industrialized nations, estimated to affect about 20. WHO fact sheet actually said between 11 and 20 million people are affected annually, okay, causing about 128 to 160,000 deaths, or about 200,000 deaths, as we can see in some other studies, okay. Humans, we have said before, are the only host for Salmonella species or Salmonella typhi. Incidence is highest in South Central and Southeast Asia, as high as more than 100 cases per every 100,000 in a population. But in this part of our world, the incidence is between 10 to 100 cases per every 100,000 people or persons in a population, okay? It will also be nice for us to talk about drug resistance or drug-resistant typhoid, okay? We'll say more on that. These are some of the challenges that we are beginning to see. Years back, a number of drugs that hitherto were very effective in the treatment of typhoid, amoxicillin and chloramphenicol, today are no longer used, largely because of resistance, okay? Now, what are the risk factors for typhoid fever? What are the risk factors? How do we know who is exposed and who is not. Exposure to an acutely infected person. If you have someone around you that may be having or that may have come down with the disease, you need to be careful because you can easily pick it up from the person. Okay? We have talked about that it is contained in our stool and sometimes the urine. It's also contained in our intestinal secretions like vomitors. Okay? Now, if you have these fluids coming out from an infected person and contaminating food materials around you, you can easily pick up the infection. Exposure to contaminated food and water accounts for more disease than direct person-to-person transmission. Also, people who work in the lab, microbiology lab that handle samples, specimens of infected individuals, talking about blood, stool, and urine, are equally predisposed to having this disease. Okay, so universal precaution must be applied at all times.
Okay.
Other risk factors that can actually predispose one to having typhoid fever are things that can reduce the acidity in the stomach. A number of disease conditions can actually do that. A good example is PUD, peptic ulcer disease. It can reduce the acidity. Usually in our stomach, we have a medium. The environment usually contains acid. The type of acid it contains is called gastric acid or hydrochloric acid, which is a component of not just the hydrochloric acid, but potassium chloride as well as sodium chloride. Okay? Now, when you have a disease condition that has the capacity to decrease this acidity of the stomach, it can actually expose such an individual or predispose such an individual to having typhoid. There are a number of other drugs that can actually predispose an individual or can reduce the acidity of the stomach. We can have that in a number of medications like some drugs that we use in the treatment of ulcer, talking about proton pump inhibitors, PPI, proton pump inhibitors. A good example is omeprazole. If you're on a prolonged therapy usage of such drugs, it can actually predispose you to having typhoid fever.
Okay.
Also, people who have undergone stomach bypass surgery, okay, are equally predisposed to having typhoid. Okay. Antibiotics, excessive use of some other antibiotics that has the capacity to disrupt the intestinal flora can also predispose us to having this problem. Contaminated water or ice. I was in a party very recently, and just beside me, I discovered that somebody was trying to scoop ice on top of a big cooler that has bottles and ice that were meant to cool the drinks. He was trying to scoop it. Initially, I didn't know what he was trying to do.
So I to give you guys for your drink?
No. But he actually used this himself. After scooping it, he poured into a glass of water, a glass, and then poured wine inside. I shook my head. Time. I considered walking up to him, but such was not an environment that we attempt that for obvious reasons. The person may not understand. Of course, my action may be misinterpreted. So I allowed that to happen. So we should avoid using ice, especially when we are not sure of the sources. Okay? Sometimes we'll get to a party and they're distributing ice. Give me ice, give me this, give me that. You don't even know whether it was made with well water. Okay? Such are areas through which we can inadvertently, without knowing, pick up some of these infections. So it's important we point them out.
But sir, I will pause you a bit to open the phone line and I'll ask a question on that. Well, viewers, if you just join us now, Health Matter, now you they watch where we discuss health issues, and time don't reach, we'll go open our phone lines. Anything where they do your mind yaga as far as health they concerned, be something they even do you for body where you want as Dr. Batty here. Feel free. Amo, first turn down the volume on your TV set so that we'll go feel enjoy ourselves.
Yes.
Slimmy?
Yes, Chief. Okay, so the numbers are there. You guys can give us a call, 08173147589, and of course 08105434984.
Okay.
Which one is this special? Okay, Chief has a question.
My question is, when he talks, maybe ice, their sources and everything, the elementary science we are taught in school, we say once any form of water gets to freezing point,
All these germs
inside,
don't kill, even
they
if
will
it's
die,
boiling
or
or
maybe
so.
will boil.
Yeah.
So how that one it take? Is that theory? Say no hold water again. Now one be that.
What has changed?
What has changed because science every day improve.
Yeah, sure.
That's one. Number two question be say most of us they get this belief say the higher stage of malaria is typhoid. That's a domestic belief. I want make you first quickly help us through like say true. If person get malaria
and you don't treat, you no treat am, they migrate to typhoid.
Abi typhoid na different disease because if person for instance if person get ear problem which is a disease on its own, you no go link am to typhoid. But
once you have headache or once you have malaria, more like
people say then your body come
how long have you been treating it? It's typhoid. And doctor, just to add so that I go just answer us all together, just to add to wetin Chief talk, you know, in this part of Africa I also believe so once you begin to get constant headache and maybe you don't check your BP, no be BP, the next thing they tell you is typhoid fever. So does constant headache, does it have any relationship to do with typhoid fever?
Yes, it does. Let me start from that last one. Shortly, we'll see some of the presenting symptoms or clinical signs and symptoms of typhoid fever. Okay, top on the list, among the major symptoms is actually headache and fever. Okay, but we'll talk about it shortly. But not to forget the two questions I asked. Can one transform to the other? Talking about malaria and typhoid. The answer is no.
Really?
Yes. Now, when we dealt with malaria, we mentioned the causative organism. Okay? Usually, malaria is caused by a parasite.
Yeah.
The name of the parasite, the one that troubles us most in this part of the world is falciparum. Okay? Plasmodium falciparum. That is the one that troubles us most in this part of the world. It causes about 99.7% of all malaria in African sub-region, according to WHO. Now, there are other forms of other types too that can cause, talking about plasmodium, that can cause disease in man, the ovale, the vivas, and the malaria. Okay, and then the lesser known one, the one that affects the zoonotic component to it. Now, that said, when we talk about typhoid, our emphasis is not on parasite. Emphasis on bacterium. And the name of this bacterium is called Salmonella typhi. Okay, I've talked about paratyphi A, B, and C, which do not cause as much disease as Salmonella typhi. Okay, so that is the major causative organism when we talk about typhoid. But the similarity between the two, the common denominator, the similarity between the two, or a number of similarities between the two, is that it is difficult to actually differentiate some of these symptoms. Okay, so the only thing that can help one to differentiate in terms of the symptoms is to avail yourself of laboratory investigations, to do some tests, some clinical tests, to actually say this is this and this is that. That is because, for instance, fever and headache can be found in both two disease entities. Okay, abdominal symptoms, gastrointestinal, GIT symptoms can also be found in both of them. Okay, so but what I want to point out is that typhoid is not as common. That is the message. It's not as common as malaria, at least in this environment.
Okay, but which one is more deadly?
Both are deadly, but malaria is more deadly. Okay, but both can kill if they are untreated. Okay, so back to some of the risk factors we were talking before we left.
The issue of the eyes.
Okay, so yes, the eyes. Now, not all the microorganisms. We have Sheun from Oyo.
Sheun, good morning.
Hello.
Good morning.
Good morning.
Good morning.
Good morning, sir.
My question is, my name is Sheun from Lanlade, Oyo State.
Yeah, good to have you.
Now, I want to ask the doctor, what advice could you give us? In these days, you will see bottled water, minerals under the sun from morning till night. And we are saying bottled water is okay for someone to drink instead of sachet water. But right now, I could perceive that every shops that are selling this bottled water, they are placing it on the sun, under the sun from morning till night. Now, we will now go there and buy it and drink it. What advice will you give us in order to avoid this typhoid or whatever malaria we are talking about? Or is it not intoxicated? That's my question.
Thank you very much, and it's a very good one. Thank you very much, Mr. Shehu. Now, I must also, while he was asking the question, I also was thinking along that line, because sometimes you leave your comfort zone, you leave your house, you leave your offices, okay? You don't have the luxury of carrying with you enough water. Yeah. Even if you take 1 or 2 bottles and you're driving or you're on a trip,
it up
you need to buy more.
Yes, beyond that, it could get hot because we know our environment, we know our climatic conditions. Okay, so I think a lot more will be done by government agencies that regulate some of these bottled water or sachet water. Some of them are not as pure as we are.
As we call them.
Yeah.
As we think they are. Let me use the word. They are not as pure as we think they are. Okay, so, but we are somehow disadvantaged. Okay, so for instance, if you're a traveler and you're thirsty and you need to take water, and you're in a particular locality where you cannot even do sterilization, even if you're a doctor and you know all to do, or what to do, sometimes we'll tend to stick to some particular brands. But oftentimes you discover that these brands that are popular are the ones that affect most.
Because they know that's the higher demand.
The one that moves market. So they fake it. A lot of fakes are out there. So it's a difficult riddle. It's a difficult question to answer. So there's no way anybody can ask you to stick to a particular brand of bottled or sachet water. But talking about the effects of sun, if it becomes hot, if anything, it will help in the purification.
Really?
Okay, so becoming hot does not in any way make it unsafe. Okay, so the heat will not make it unsafe. Okay, but it's difficult to actually say this is the way to go about it. But if, as much as you can, if you have the ability to do so, the capability to do so, ensure that all the waters that you drink, as well as you and your family members, are boiled. If you can't trust some of those sources, in as much as I wouldn't want to mention brand names so that we don't end up advertising for anybody. Okay, if you're in a place where you can't lay hands on anyone that you think is safe enough, please and please do boil the water you use at home with your family. In some situations, if you can still not boil the water, the number of disinfecting agents that are sold in pharmacies that can be used for drinking water, that you can actually stick in a tablet in a liter of water, and after a while, it can actually make it purified. So that can also help. Okay, thank you very much for that question.
Okay, you answered your question.
Yeah, now talking about ice, if typhoid could still be found in ice, not all microorganisms are killed with heat. And again, it depends on the degree of heat that we're talking about here. Okay, so some survive in colder temperature. So some can actually survive with ice. So that on its own, the fact that it is cold don't make it pure, doesn't make it pure.
And the fact that
so
was well boiled does not also make it.
No, but if you boil the water and then if you boil the water and out of a purified water you make your ice, that's safe.
Okay.
But what I'm talking about is the ones we usually see in commercial quantities that people sell, or sometimes you get to party and they are distributing it and you don't know the source.
And they are using the beer and the
to pack it.
They're like the person I saw recently.
That's interesting.
That's what they do anyway.
Trying to scoop from above and then so those are some of the that we don't even know we are doing that. Stella, good morning.
Hello.
Good morning, Stella.
Doctor.
Yeah.
Good morning, doctor.
Good morning.
I love this program, but there's something I want to ask you.
Please go ahead.
There's some time ago they say eradication of fever, as in malaria fever, to eradicate it. Well, you don't make it a constant program, so this malaria of a thing will now subside. It has been a routine thing. Anytime that one is sick, they say typhoid or malaria. I don't know whether you have gone to a song or what. I think there will be eradication of it.
I'm not sure I got you clearly, but if you're talking about eradication of malaria in this environment, we are striving to do so as a nation. The world is striving to do so to help regions of the world or countries of the world or communities that have malaria. Okay? Now, what causes malaria? Malaria has to do with the mosquitoes we have in our environment. Specifically, female Anopheles mosquitoes are the ones that are responsible for transmission of malaria. So long as we keep having them in and around us, or with us in our world, in this part of the world, elimination is a distant option. Okay, so if we're able to eradicate, if we're able to eliminate them from our environment, we can then start talking about eradication of malaria. Okay, so I think we need to point that out. Thank you very much. Okay, so, but today we are dealing with typhoid fever. Okay, so some of the risk factors that I would like to mention that sometimes we actually don't take a good look at is the fact that some food and drinks that we purchase from food vendors, talking about stuffs like Zobo, okay, and other things that we can purchase from food vendors, Kunu, and what have you.
Tapioca.
Yes, these are some of the sources through which one can actually pick this typhoid that we are talking about. If they are contaminated, okay. Now, also, people who are in the habit of consuming raw vegetable, usually some of them are contaminated if they are the ones that were irrigated. Yes, if they are or even salad, foods that are not properly cooked. For instance, if they are grown with fertilized sewage or irrigated with infected water, or sometimes flooding can actually push the sewage from our homes into some of the farms around. And then someone goes in to harvest them, and then the next moment he or she dumps them in the market. And then you buy them without washing them properly and all that, and you prepare your salad and what have you. Okay, so these are some of the sources through which we can actually pick up these infections even without knowing, casually. Okay, now if you also have relations in your house that have one form of ailment or the other, you may not know the one they have. As much as possible, let's keep proper hygiene in and around our homes. Okay, in a number of homes, you discover that our sewage pipe, talking about the feces that are coming into our houses, are usually channeled into the gutters. It is very wrong to do so, because anytime it rains, you can't tell where that flood can take it to. Okay, so the whole environment can be contaminated. It could push them into a farm, thereby contaminating whatever may be planted there. At the end of the day, somebody harvests them and dumps them into the market, and someone goes to pick them up to use them to prepare
without cooking,
salad like and that. Yes. Okay, so also, I think you mentioned Kunu.
Yeah.
Those of us who are in the habit of drinking raw milk, we should desist from that. These are some other ways through which you can pick up this infection. It must be pasteurized milk or boiled milk. Okay? Now, other risk factors that I would like to talk about. Okay, we talked about evidence of prior Helicobacter pylori infection. Okay, someone who has had ulcer before, that can also happen. Okay, now, talking about pathogenesis, this is a little bit medical.
Okay.
Salmonella typhi are acquired through fecal-oral route. When you ingest them, when you eat them, food that are contaminated with this, they get to your intestine. They get to they get into our system. Okay. Now there's an aspect of our intestine, small intestine, that they usually will go and multiply in large numbers. They're called Peyer's patches. It's contained. Now, what is Peyer's patches? It's a lymphoid tissue that are usually found in a number of areas in our small intestine.
We have
Olu, good morning.
Good morning.
You have to speak a little louder, please.
Yes, struggling to hear you.
Good morning.
Yes, good morning.
Sir.
Good morning, my brother.
We can hear you, sir.
Okay. Sorry, you're treating typhoid issue.
Yes, sir.
All right. Sorry, Okay. I really want to find out, because I had an experience previously taking all these things you mentioned, the Zobo and all that, Kunu. Eventually, every week I treat typhoid then. So I had to stop taking those things, and eventually the stuff ceased. But along the line, I keep experiencing pain around my spinal cord. Sometimes I cannot bend. You know, in fact, right now as I'm talking to you, I'm still having that thing. But on its own time, at its own pace, it goes away without even treating it. So I don't know whether that is part of the symptom of typhoid, or perhaps it's the way I lie on the bed or the kind of mattress I'm using. I don't know.
Thank you very much, sir. How old are you, sir?
I'm 44.
44.
44 years. Okay, thank you very much,
Yes.
sir. Okay, so
Thank
now, to point out, the back pain that you're having could be as a result of a number of factors. So it's actually difficult to say that it's related to one particular disease entity without the benefit of conducting one or two clinical investigations to actually find out. For instance, we do know that oftentimes when we attempt to carry a heavy object bending forwards, sometimes we could have a snap noise at our back, and afterwards such a person will start having severe and excruciating pain on the back region. That can happen, okay? Sometimes we refer to them as lumbar spondylosis, but that will be when we must have sent such a person to do an X-ray of the lumbosacral spine, okay? If we see changes that are in keeping with that, we can make that diagnosis. Also, if you remember when we treated tuberculosis, for example, you could have someone could present with severe low back pain, as can be found in Port disease or TB spine. So there are a number of disease conditions that can actually present with back pain, okay? Typhoid could give you generalized body pains, okay, but not specifically back pain. So my advice would be for you to see your doctor for further evaluation along that line. So it's difficult to actually say it could be this or it could be that, okay? Now, we're talking about pathogenesis a while ago. Now, what essentially this is all about is when we ingest, in the course of eating, if we take water, take food that is probably contaminated, the microorganism, this Salmonella typhi, finds its way into our body. From the stomach, it goes to the small intestine. Okay, small intestine is usually divided into three parts: the duodenum, the first part of the small intestine, the jejunum, and the ileum. My doctor. No, usually you have Peyer's patches scattered in this group of organs, but they're more in the ileum. Okay, so that's usually where the Salmonella typhi has predilection for. So it goes there, stays in that lymphoid tissue, and multiplies over time. From there, it gets into the blood stream, and of course, such a person can be coming down with symptoms. I also want to say that this organism is usually encapsulated, so it has a capsule, so it can actually survive within the cells intracellularly. Okay, so the process of the mechanism by which the body tries to fight it is usually not a perfect system, in the sense that it can actually resist phagocytosis and all whatnot. So it gets into the bloodstream, having multiplied in large numbers, and it can start manifesting with symptoms. So that will take us to signs and symptoms of typhoid fever.
Before we do the signs,
like we're waiting for the signs and symptoms.
Yes, we'll quickly go on this short break, and we shall be right back. Go nowhere.
Just very short.
Do you know the average life expectancy for a man in Nigeria is about 53 years? Nothing is as important as your health. Health Medical Center Open Day Men's Health 2019. Free basic health screening, eye screening, blood pressure, blood sugar level, body mass index, risk assessment for prostate and colorectal cancer, and discounted PSA and colonoscopy test. Date May 4, 2019. Time 8 a.m. to 6 p.m. Venue 9 Anthony Etukudo off Okunubi Street, Admiralty Way, Lekki Phase 1, Lagos. Health Medical Center Open Day Men's Health 2019. Focus on your health, not your wealth.
matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top we health matter. You fit also advertise your product and services on top we show wey dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Yes, welcome back to the show. Okay, we're focusing on health matter today. Okay, so we are focusing more on clinical features that we can see in typhoid fever or enteric fever. Now, typhoid has an incubation period that ranges from 3 to 21 days. Averages between 10 to 14 days. Okay, some of the clinical features that we can see with typhoid fever, usually you have the early flu-like symptoms. Okay, beyond that you could have chills, which you can have in 35 to 40% of cases. You can have headache. She asked about that a while ago. And you can have that up to 80% of time you have headache in people who have typhoid. So it's one of the major symptoms of typhoid.
I don't know. I think when I have my own typhoid, self-diagnosis now anyway, the headache is usually from, I don't know if it's a personal thing, it's usually from the back side of my head.
Now, that's the impression we are trying to correct. Okay? People believe they have certain group of symptoms for their own typhoid and for their own malaria. No such thing exists.
Really?
We said at the beginning that this is one disease that is oftentimes, many times, misdiagnosed. Ostensibly by the individuals involved, not even by health caregivers now. Okay? But sometimes misdiagnosed, overdiagnosed, and sometimes misdiagnosed. Okay? So sometimes you see people say, this is how my typhoid presents. This is how my... In most of those situations, the person may not have had typhoid. Now, if I tell you, we'll see that shortly. One of the main reasons why people talk about the fact that they have typhoid is wider tests. And we'll see a lot about wider tests because we're trying to let people put the right information in public domain so that people can know. Yes, wider test was a test that came out because he asked this question, so I'm jumping now. Wider test that was a test that has been in existence for more than 100 years. It used to be effective years back, but not anymore.
And people go, they say wider test.
Okay, so it is not used again as
It was
preferred, mark my word, it is not used again today as a preferred diagnostic tool for typhoid. As a matter of fact, among the avalanche of tests that one can do to actually dictate who has typhoid and who does not have, is at the lowest ebb. The least is non-specific, can give a lot of false positives, is not reliable. So let us know today that wider test is not reliable. Okay, it was because you said that we're trying to
do
jump.
wider tests for
he said, let me just do wider test.
Okay, so we'll come to that. But having said that, the mainstay of diagnosis, okay, because I don't know how much time we have left, the mainstay of diagnosis is culture. Culture. Now, depending on presentation of the patient, which of course we are going to see shortly, blood in the first week can be cultured, stool in the second week, as well as urine in the third week. No, but the one that gives the gold standard is bone marrow culture. Okay, but to retrieve or to take bone marrow from someone is an invasive procedure.
If not expensive.
It's expensive, it's very painful. Okay, so because of all of this, the use of bone marrow transplant for diagnosis of typhoid, which can actually give us greater than 90% sensitivity, okay, is usually not used widely. Okay, but the blood culture can help. Okay. The blood culture can give us a good result. The stool culture can give us a good result, depending on the periodicity as well that we have talked about. Okay, but let's not, we'll still come to that so that we can go to clinical features because there are a lot we can talk about in the clinical features. Okay, so for chills, you could have that in 35 to 40% of cases. Headache, we have said about 80%. Anorexia, inability to eat, 55%. Cough. Typhoid can also present with cough, 30% of cases. Yes.
High fever, uncle.
That is the major one. We are getting to that shortly. Other clinical features that you can see, symptoms that you can see with typhoid is weakness, sore throat, dizzy spells, increased sweating, 20 to 25%, myalgia, that's body pain, malaise, feeling of unwell, okay, 10%. Arthralgia has to do with bone pains. You could have that in 2 to 4% of cases. But the most, yes, GI symptoms, we are coming to that. But the most prominent symptom is prolonged fever. I need to stress that. Prolonged fever. Usually the type of fever we have here is stepladder approach. Okay? The fever keeps increasing, just like if one is climbing a staircase. Increasing and could go as high as 40.5 degrees centigrade. And usually by the next morning, it drops. Okay, so apart from the fever, if it is untreated, this fever can span for as much as 4 weeks. We can see some of the clinical features that we are seeing. But the one that is usually pathognomonic, specific, that's the word, for typhoid, is fever and bradycardia, the one in red that you can see. You can see the fever is at the center. It's the major organ there. Okay, so the one on top of it is bradycardia. Once you're having a patient with fever as well as bradycardia, you should be considering. Yes, I'm coming to that. Now, bradycardia, forget about the big name. It has to do with the beating of our heart, human heart, over a period of 1 minute. Usually, the beating should, the normal heartbeat should hover between 60 to 100 over a period of 1 minute. But if you have your heart beating below 60, it's called bradycardia. If you have it beating above 100, it's called tachycardia. Okay, so you have that in typhoid. We'll refer to it as relative bradycardia, but it's actually not a diagnostic tool because it's not something you can easily pick. Now, GI symptoms that you talked about, okay? So we have nausea, we have vomiting. In some instances, we have diarrhea. In some situations, we also have constipation, as well as abdominal pains.
I think at this junction, we'll have to say thank you very much. Most definitely now, something we'll go continue with.
Are we going to
Yes, we need to continue.
Because we never even entered deep places.
There's so much to be talked about.
Okay, viewers, we want to say thank you very much. We're going to always stay tuned. And from Slimity.
Yeah, see you guys. 1 to 2.